Hi and welcome to Dr. Huma Tutorials. This is one of the topics of basic pathology, fluid and hemodynamics. The topic of today's tutorial is hyperemia and congestion.
What does it look like? It is a capillary, or maybe it looks like a capillary. This side of the capillary is known as arteriole, and this side of the capillary is a venule. Okay. Now, you know what kind of blood enters in an arteriole. It is from the arteries and it carries oxygenated blood. And as the oxygenated blood will be red in color. Okay, here we are talking about hyperemia. When the blood flow is increased, blood flow is increased in the arteriole with the oxygenated blood, that will give red color, and this is called hyperemia. This will result in blushing. On the other hand, we're talking about the venule. Now, the flow has decreased and the blood that the venule carries is deoxygenated blood. It will be blue in color. This will result in congestion, resulting in cyanosis, bluing, okay, blue color. And the flow here has decreased. The flow here has increased. There is vasodilation. The flow has increased. Okay, this was all about these two, hyperemia and congestion. Another thing that you should know is that hyperemia is an active process and congestion is passive. Okay, now talking about congestion, which is passive, we'll take two examples, two of the areas where it is affecting. One are your lungs, and the other one is the liver. There can be acute cases when the time duration is shorter, and there can be chronic cases when the time duration is longer in both the cases. So we'll take it one by one. First, we're discussing the case with the lungs. Okay, so what happens in lungs? You know, in lungs, there are many alveoli. And these alveoli have alveolar capillaries. So in acute congestion, what happens is that these capillaries are congested. So there will be congested alveolar capillaries, Okay, and the septas between these alveoli, there will be edema. So there will be septal edema and intra-alveolar hemorrhage. Okay, so the blood will leave the alveoli and it will collect in the intra-alveolar space, intra-alveolar hemorrhage. These are the cases that will happen in acute congestion that is occurring in the lungs. But the chronic case is a bit different. Chronic congestion of the lungs. Before discussing, we must revise how the heart supplies to the body. So you must remember there is a right ventricle, which pumps the blood to the lungs. And from the lungs, it is received by the left ventricle, which pushes the blood in the body. Okay, so what happens in this case when the left ventricle fails to pump blood in the body? When the left ventricle fails, all the blood will pool in the lung. Okay, so we are talking about left ventricular failure, and the blood will be pushed back to the lungs. And what will happen? Again, talking about the alveolar capillaries. Okay, so now the pressure will increase in the alveolar capillaries because of this backflow of blood. The pressure will increase, and as a result, the RBCs which are present in the blood will be released by these alveoli. Okay, so the RBCs will be pushed out, and the macrophages. Let me just write it. So the RBCs will be taken up by the macrophages. RBCs will be engulfed by these macrophages, and they will make what we call as the heart failure cells. What are heart failure cells? It is actually those RBCs which are pushed out due to increased alveolar capillary pressure. Okay, and in other words, it is hemosiderin containing macrophages. So this RBCs will give a brownish color due to the pigment called hemosiderin, and this is contained in the macrophages. So hemosiderin laden macrophages are heart failure cells, and it is occurring because of this left ventricular failure, which has pushed the blood back to the lungs. And this is what happens in chronic congestion of the lungs. We'll discuss about two things: lungs and the liver. We are done with the lungs. Now we'll discuss what happens in the liver. Again, if you remember some of your previous knowledge, that the liver has hepatocytes. There is a central lobule, and this is something similar to what a hepatocyte looks like. Okay. So, in this case, the center of the hepatocyte will be congested. It will be red. And peripheral region of this hepatocyte will be uncongested. That means it will be yellow in color. Okay, this appearance looks like a fruit which is called nutmeg, which I'll just show you in a minute. The appearance is similar to a nutmeg because nutmegs appear similar. It is brownish in the middle and yellowish in its periphery. Okay, why it is like a nutmeg? Because the center lobule is congested, so it will appear red, and the peripheral region of this hepatocyte is uncongested, so it will appear yellow. Okay, red and yellow. Okay, and what are we just seeing? We are seeing a hepatocyte which is congested. Okay, again, why the periphery is uncongested? Because you should know that the peripheries are closer to the hepatic arterioles. Okay, hepatic arterioles. So it is receiving the blood supply, extra blood supply from the hepatic artery. The center is congested and red, and it may lead to necrosis as well. Okay, this whole appearance appears as a nutmeg. Okay, and we can also call it as petty change because it's a reversible change. It's the initial changes that is occurring. Fatty change, fatty liver. These are the names that you will also hear about this condition. And this was about the liver, chronic congestion of the liver. That's it. I hope you understand.
Don't forget to like, comment and subscribe to my channel Dr. Huma Tutorials.